Hello everyone, this is Dr. Madhuri from Team MDSCONQUER. So we'll see the healing of extraction wound in this video. So we'll see the events now. So immediately after the extraction, what happens means the blood will fill the socket, okay? Then the coagulation of blood happens, that is the clot, and ends of torn blood vessels in the PDL. That means the blood vessels which are torn in the periodontal ligament will stop the bleeding. Then in the first 24 hours there is alterations will be seen in the vascular bed, that is vasodilation and the engorgement of the blood vessels in the periodontal ligament. Then afterwards there will be mobilization of the leukocytes to the surface, and because of that surface of the clot is covered by a thick fibrin, and finally there will be a clot retraction. So these are the events which takes place within the first 24 hours. Then in the first week, the clot is replaced by the granulation tissue, and the alveolar bone crust will show the osteoclastic activity, and edges of the wound will continue to exhibit a epithelial proliferation. So these events are very important. That is immediately what happens. Then after the first the 24 hours what happens, then coming to the first week. Then the second week you can see these events, that will clot will continue to organize, fibrin meshwork is formed, there is development of new blood vessels, that is neoangiogenesis. Then the trabeculae of osteoid will enter into the socket. Then osteoclastic resorption of the cortical margin will be distinct, and finally the any remnants of PDL is there, they will undergo a degeneration, and which are not, and they undergo a degeneration. Then in the third week, the mature granulation tissue is seen. Then the trabeculae of osteoid will form around the entire periphery of the wound, and the crest of the alveolar bone is rounded by osteoclastic resorption. And at the fourth week, this is the final stage of healing occurs here. That is, there will be continuous deposition and remodeling of the bone. So we have seen immediately what happens after 24 hours or within 24 hours, then first week, second week, third week and fourth week. So this final stage of healing will happen in the fourth week, where continuous deposition and the remodeling of the bone occurs. But this is very important. The radiographic evidence of bone formation does not become prominent until the 6th or 8th week of tooth extraction. That means the bone will appear on the radiograph only after the 6th or 8th week of the tooth extraction. And the complications of wound healing will be of your dry socket and fibrous union. Dry socket is very, very important. So if you take the dry socket, these are the other names, that is the fibrinolytic oleolitis, or a alveolar osteitis, localized osteitis alveolalgia, and alveolar osteomyelitis. So these are the other names of your dry socket. And here this actually it is a complication of the extraction of the teeth, and this involves the part or whole of the socket. I mean, a socket is involved partly or complete socket is involved here, and this is characterized by acute pain, and this bony walls of the socket are denuded with the blood clot. So blood clot is missing within the socket. Then etiology, maybe any the microbial etiology can be present, or trauma and infection together, whether a high traumatic extractions or a microbial, or both can be the etiology of this dry socket. Okay, they will cause the inflammation of the alveolar bone marrow spaces, so that they will liberate the tissue activators, which converts the plasminogen in blood clot to plasmin. Okay, this is very important. Plasminogen is converted into the plasmin, and this dissolves the blood clot and releases kinins from the kininogen, which is present in the blood clot. Okay, so why blood clot disappears? Because this plasminogen in the plasmin will convert the blood clot and releases kinins from the kininogen, which is present in the blood clot. And the final result will be the dissolution of the blood clot, and severe pain can be seen. Then the predisposing factors may be infection, whether it may be before, during or after the extraction, or a trauma, Then vasoconstrictors like used in LA will predispose the dry socket. This is why, because it will interfere with the blood supply of the bone, thus with the bone. But thus, I mean, this vasoconstriction cannot be primary cause, but it is one of the predisposing factor. And the mandibular teeth will have a higher incidence of dry sockets. Why? Because as it is known that the mandibular bone will have less blood supply, and it is very dense when compared with the maxillary bone. Then the gravity, that is mandibular sockets become contaminated because of the food debris. Then the existence, that is any systemic ethological factors like insufficient evidence to support this concept, but any fibrinolytic substances, there is, if there is any increased titer of fibrinolytic substances, so it will one of the cause the predisposing factor. And the bacterial origin, in this you have to remember the name, that is Treponema denticoli, which is the etiological role in the dry socket. Then even the pregnant women who are taking the oral contraceptives are also susceptible to formation of the dry socket. So those are the predisposing factors. How to prevent this? Because you have to scaling of the teeth should be done before, prior to the extraction, and a minimum amount of local anesthetic should be administered. Teeth should be removed in a least traumatic manner, and the prophylactic antibiotics like metronidazole before 3 to 4 days will reduces the incidence of dry socket. And after the extraction, wound debridement should be done, and better to prefer the nerve blocks when than the local anesthetic infiltration. So these are the preventive methods. Then managements include, first, to relieve the main thing is to relieve the pain, and to increase the, to speed the healing of the socket. So you have to do the irrigation of the debris and debridement of the socket. This irrigation should be with a warm saline, and you have to check whether any sharp bony margins are there. Then you have to smoothen those bony margins. Then a medicated dressing or a iodoform gauze should be given, or a zinc, it can be given with a zinc oxide eugenol also. And this, and there is a one dressing which is composed of eugenol, balsam of Peru, chlorobutanol and benzocaine. Dressing should be given for first 24 hours, then after alternate day, then every 3 to 4 days for more than 2 weeks. This is very important. First 24 hours we have to give, then every alternate day we have, then every alternate day, then every 3 to 4 days for more than 2 weeks. And we can use the broad spectrum antibiotics also. And other measures include like analgesics and hot saline mouthwashes can be used. And if the pain even persists, the procedure is, you have to chemically, the bone may require chemical cauterization. Okay, this includes, this procedure is first to isolate and dry off, you have to dry the dry socket, then apply small quantity of carbolized resin, and zinc oxide eugenol dressing should be inserted and left inside for about 3 days. Then the dressing relieves the pain, but this dressing will delay the wound healing. So in order, other than the zinc oxide, even a whitehead varnish on a ribbon can be used for a 2 to 3 weeks. Okay, and at the time of removal of the pack, the socket will be seen granulating. That is, after the 2 to 3 weeks, you will see that the socket is granulating if you use the whitehead varnish. So those are the extraction socket healing. And the important here is the dry socket, that is a complication of wound healing, and the sequence, that what happens on the immediately first week, second week, third week, and finally the fourth week, and the radiographic evidence of the bone formation. Okay, thank you. Happy learning with MDS Conquer.